Switching to the live streams, okay. So we are on live now. Ayariga, are you there? Okay. So we can start. Nothing I desire can worship you. Lord, you are so beautiful. So pediatric nursing. I've tested everything. Everything is working now. So welcome to our channel and our platform. If you are new here, my name is Paul Bright. I work with a team, and I always say that I'm the presenter. A lot of people are working behind. They are working so that everything will be perfect for us to share the health information to the world. Okay. Yeah. So I'm Paul Bright, and today I'm starting with pediatric nursing. Pediatric nursing. It is not solely for NCLEX. Yeah. It is for everyone who is a nursing student, a new graduate, okay, health workers who wants to know much about health to help develop your progress to progress in in your field of work skills. Yeah. So please, and do us this favor when you join and you are not talking, please mute yourself. Okay. So that because people are listening live and they are taking, you can record it or you can go to our live channels and watch the videos. We leave it there, it's there forever. Okay. So you can go there and watch, download, share, and let others also benefit from what we are doing. Okay. So today we are starting with pediatric nursing. We did maternal health, I think, for the past 2 weeks. So today we will start with pediatric nursing. Okay. So let's start. APGAR scoring. ABGA scoring. When the baby is born, this baby is born. Whether the baby was born in theater or baby was born in the labor room, in maternity, this baby needs to be assessment. Okay. So when you and I were born, according to nursing process, that is the ADPI. According to nursing process, or according to the nursing procedure manual, or according to the nursing protocol, you need to assess first. Okay. So let us assess this baby as a health worker. That is the first thing you need to do. Okay. This assessment we do for newborns is what we call the ABGA scoring. The ABGA scoring. And you do the assessment on 3 different occasions. On the first minute, so baby was born 10 o'clock a.m. I don't know the time at your end. 10 o'clock a.m. 10:01. Baby will be assessed. 5 minutes after the baby was born, 10:05. Then the 10th minute, and it goes like that. Okay. Yes. We do this. This is a rapid assessment of newborn who has transitioned. Those of you who join maternity, you know, when we say transition, you understand the word. They have moved from uterus life to extra outside uterus life. Okay. Inside the uterus, there was protection, there was warmth, there was amniotic sac, amniotic fluid, blood supply, okay, through the placenta, the umbilical cord, all these enjoyment, the baby was enjoying it, okay. The baby's heart, the chambers were not all closed, no stress, the lungs, I mean, it doesn't do much work. The surfactant is not grown well, okay. Now, all of a sudden, baby has to come out of this comfortable zone, a zone that they will see everybody with different shapes, body shapes, eyes. The air that was blowing inside the uterus of the mother, the air that the baby is blowing around this baby is different from the air that he or she was receiving inside. So that sharp, that quick changes can affect the physiological strength or the physiology of this baby. Okay, so what are you supposed to do? You need to assess on the first 10 minutes. Divide the 10 minutes into 3 and do your assessment. We call it the ABGA scoring. So first minute will tell you how well the baby tolerated the birthing system. Okay. First 1 minute. First 5 minutes will tell you how healthy the baby is now adapting. Okay, 1 minute, we've done the first one, the first minute. Let's give baby 5 minutes to see. Now, air is blowing, people are walking, somebody is touching you, somebody is like, you're happy, baby on the chest of the mother, breastfeeding, bonding, whatever. How healthy the baby is adapting. Okay. So when you do this 1 and 2, and you do your scoring, and it's below 7, then it is mandatory to do what? The 10th minute. It's not by force. Okay. If baby is well, you can stop at 5. But if baby is not well, do your 10th minute. Or it depends on you. You are a nurse. Baby, you've done the 5th minute. Baby is well. Baby has scored 7 and above points at 5 minutes. Yes, it depends on you. It is your shift. You are the in charge. Okay. The baby and the mother is your patient. So if you want to do the 10th minute, I mean, it's not by force. You can do it. Okay. And do and write your documentations. So that is ABGA scoring. Let's go down and look at the what goes on in ABGA scoring. So these are the components. Let me highlight it for you when you get a slide. And these are the points. These are the points. So the point is up to 2. Okay. These are the components we are looking at. For you to score 0 points, you should present any of these signs and symptoms. The baby should present any of this. For the baby to score 1, the baby should present any of these signs and symptoms. And for the baby to score 2, that is the master. You say, salutes, baby. You should score this. Okay, so let's take. We say ABGA, 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 ABGA. It is the first letter of these words that we've taken and form an acronym called ABGA. Okay, the first letter, alphabet, the first alphabet of these words that we've taken and formed the acronym or the mnemonic ABGA. So when we say A, this A, it means appearance. The first letter of appearance is A. That is why we got this A here. So let's go and look at the appearance of this baby. Baby was born first 1 minute. You look at the baby. The color was what? Blue or pale. Okay. Blue or pale. Wow. Then you ask yourself, this is the baby. This is the head. This is the chest. And this is the abdomen. Okay. Then we have extremities. That is how everybody looks like. Extremities or appendages. Okay. Appendages. Yes. So when we are looking at your appearance, if you see a human being and you want to judge the person, you look from what? It depends on you, from down to head or head to down. You want to first check appearance. It's very important. So the baby is in your hands. Where are you looking from? That one is not in science. You determine, should I look at the baby naked from down to head or head to down? Okay. You looked at the legs. The leg was blue or pale. The legs were blue. You looked at so it means you are looking from outside to inside. You looked at the hands. The hands were what? 0 or pale. Then you came to the chest and the abdomen. Okay. So you look at the chest and the abdomen, they were also blue or pale. And the head blue or pale, the face, whatever, the neck. So you score this baby. Baby, you can't score. I'm very sorry. I can't give you any score. So I'll give you 0. Okay. Let's go and take the same baby. The same head, neck, chest, abdomen, leg, hand. I look at the legs. It was still pale. I looked at the hands. It was still pale. But when it came to the central aspect of the human body, the center, it was pink. It means what? If this is pink, it means it's getting enough oxygen, enough blood supply. Okay. Should I give 0 to this baby because of this presentation? No. If I do that, I'm not fair because the guy who was here had 0 for everywhere. But this one is having pink for head and neck and chest and abdomen or back. Then only the extremities are having bluish or pale discoloration. Okay. So we say this is what? Acrocyanosis. This is the medical term. Okay. Or peripheral what? Cyanosis. Peripheral cyanosis. In peripheral cyanosis, give the baby time. It's 1 minute. Give baby time. Baby will recover. Sometimes you can do oxygen, blow by. You don't even fix the mask, just blow by, blow like the oxygen, whatever. Just blow it on the, put the baby down, blow it, let the air blow. Okay, the oxygen, baby will suck it in. And all the extremities will turn to pink again. Okay, so body blue extremities or pale extremities, we call it acrocyanosis. So anywhere you meet this word, don't forget. Then we have this beautiful baby with 2 points from head to leg. Everywhere is pink, complete pink. So you give the baby 2. You are done with appearance. Let's go to pulse, heart rate. Baby's mother was doing all the pumping and taking the the major pumping for the baby. Yes, baby's heart started beeping, okay, or beating in the womb. Now baby is out. Mother is not pumping everything for baby again. Baby, take the burden on yourself and do it alone. So now the heart is taking control. All the septum, the baby's heart is divided into 4. There should be a hole here. There should be a hole here when they are inside the mother's womb. But once they are out and they close, these holes automatically close. Okay. The heart is pumping. Back, back, back. You are hearing your sounds, the loop and the dot, the S2, the S1s. Okay. With your stethoscope, everything. Check the heart rate of this baby. Is it absent? We can feel heart rate. We can't give you 1. We can give you 2. It's 0. Okay. Then let's go to 1. We felt a heart rate. But inside the womb of the mother, what is the normal heart rate? 110 to 160. Okay. That's when this guy was enjoying life inside the womb. Now this baby is out. Inside the womb, he was giving us between these values. Outside the womb, now this baby is giving us 100 and below. 100 and below. Should we give this baby 2? Okay, you are not doing well. You're outside the uterus and you are doing those things. Be up your game, up your game. So this one, we are going to give you what? We still expect this baby to fall within this range for the 10 minutes or the first few days of life or months. You should still continue this heart rate. And when the baby is growing, the heart will take its time to drop, and come between what? Like you and I, you now center yourself between 60 to 100. So as you are growing, the heart rate should drop. Okay. So it will drop. If you are growing, heart rate will be dropping till one day you die and you get cardiac arrest. Everybody dying will get cardiac arrest before they die, whether you like it or not. Okay. So, baby, you can't tell me that this heart rate, you can't tell me you are giving me 70 heart rate and I should give you 2 points. No. Okay. So this is Abgar scoring. Pause is assessed. Okay. Let's go to Gene. Grimacing or reflexing. Reflex. When you say something is reflex, it doesn't need any trigger. Okay. It doesn't need anything. It occurs by itself, spontaneous. So as this baby is growing, the first day the baby was born, there was an ability. That ability is divine. No human being trained this baby to do it. That ability is divine, is spontaneous. Okay. Or nobody will trigger you, no triggering factor. Okay. So we call it what? A reflex. Can this baby climb this tree when you are born first day? No. Somebody must teach you how to climb a tree as the baby is growing. So we can say this is a reflex action. Okay. But this small baby, put this baby on top of the chest of the mother, they will suck breast. Who taught them how to suck? The mother has a neck, has a head, a neck, has an arm, has body, has breast. How was the baby able to identify that this is breast? So let me suck it. They were inside their mother's womb. Were they learning how to suck breast? Did anybody introduce breast to them inside their mother's womb? No. See, Michael is even laughing. So how was this baby able to what? Okay, so we call it what? Cumulatively, all these minor or simple abilities, they're able to clench to their mother, suck breast, all these reflexes, abilities, motor activities. Okay, we call it what? Reflex irritabilities or grimacing. And the first letter is G. That is why we got the G in the ABGA. I'm making it simple for you so that you understand. Okay. This one helps to assess, is assessed by suctioning or gentle stimulations. Okay. Yes. If I put something in your mouth, well, put syringe in this baby's mouth. Oti long, he'll be sucking everything. Okay. Yes. So let's go and see. 3 children were born. Let's go to our scale. This first child, a little, we introduced this baby. The baby had no response for grimacing. Poor response may indicate hypoxia. There is something. Remember, motor activity, sensory motor. We will learn that as we move forward. Sensory, for you to be able to sense, this is breast, let me suck it. Your mouth, the muscles there, for it to be excited, to suck, for your esophagus to swallow to your stomach, that this breast will not enter into the airway. They are all what? Sensory motor abilities. Okay? Yes. Nobody tells it when to work or when to stop work. It does it spontaneously. So this, and where are they coming from? All the nerves you see outside your body, they are coming from either the spinal cord or the brain. But their control center is in the brain. Control center is in the brain. So they take information from here and send it to the spinal cord. And the spinal cord will send it to their extremity, their mouth. These are the motor nerves. And the motor nerves will skit. Okay, so the sensory nerves will send the information to the brain. Okay, this is a sensory nerve. This is an information. There are three things, and this is motor. Okay, I have slapped Michael. Wham. This is an information. So Michael's senses will pick it. Will pick this information that the senses don't understand. Let us take it to our control center. Okay, so sensory nerve will take the slap to what? The control center, the brain. And the brain will interpret it to what? The sensory nerve that this thing that you felt here, it is not a hug, it is a slap. So never be deceived, okay? Yes, something has touched your body, but the sensory nerve doesn't understand it. That's something. So they will carry this information to the brain that please explain what happened to me. So the brain will explain it and tell the senses that, hey, this thing that touched your body, it is not a hug, it is a slap. So if you don't do something about it, it is going to harm you. They'll say, okay, is the sensory nerve, is it the function to bring the response here? No. So they will go and call their senior brother. You see, when you go to town and you go and fight and trouble comes, you go and call somebody who is stronger and you think can beat the person. So we went and called the motor nerve. The motor nerve carried the information. So the motor nerve will come and react. Yes. That is sensory motor. Okay. Assuming these guys send the information to the brain and we did not feel any response yet, what happened? Is it that the brain is not developed? Is it that something has hijacked the brain that it cannot work? Or what? Or is it that the motor nerves are damaged? These are the things that happen. So a baby is born, we've put the baby at the nipple. Everybody around is expecting the baby to suck. The question is, what is happening? Is the central nervous system depressed? Or there is hypoxia? The baby is not receiving a lot of oxygen. Because the brain as a whole, the only thing they breathe is oxygen. And the only thing they eat is glucose. The brain does not eat carbohydrate. They don't eat fat. They don't eat proteins. Glucose. Glucose. When you give the body milk, meat to chew, the brain will take the glucose aspect of it and use. That's it. So this baby, that coordination between the senses and the motor and the brain, central nervous system, standing in between, there is a problem. Okay. Yes. So what happens? You give you 0 because you were not able to respond. Yes. Second boy responded, but there was facial movement only. facial movement. We have put you, we have triggered you. Okay, we've pinched you, whatever we want to do to you. Okay, we've done everything to you. We did not see motor response. Okay, you held this baby. All these reflex senses motor. Okay, it is only your facial movement. Did you frown? Weak reactions? Okay, we can't. Yes, you have given us motor response, but we can't give you 2 marks. We'll give you 1 because we want the response to carry across the body. This second guy, the third guy, give us a proper hot. So this baby can squeeze, cough, cry, do everything. Sometimes the midwives will be beating your baby. Okay, so that they cried. Everybody and their way of assessing for ABGA. Yes. Yeah, they do these things to assess that baby cry, cry, cry. Baby will not cry. We can't give you 2. Forget. Okay. Now let's go to the A, the purely motor, muzzle tone. Muzzle. This is all about motor, muzzle, muzzle tonicity. Okay. So if this is a muzzle and I touch the muzzle should react. If somebody is sitting there and go and close the eyes from behind, they will react. You have touched their muzzle, their skin. Okay. If you hold them, if you give them that startle reflex, you will respond. Okay. Let's do the same thing to this child. This one will limp. Give you 0. This one will, you see some flexion. Okay. The legs and the arms will flex. Yes. Flex. Give you 1. Active, flexion, limping, all these combined. Turning, crying, doing everything. Yes. They say the muscle is very strong. Okay. So we give you. All these assessments are assessing the generality of this baby's health. Okay. And the last one. So this also explains the muscle tone, no movement, flaccid arm, legs, and slide bending, and all those ones. Okay. When you get the slides, you get understanding well. Okay. Now let's look at respiration. We can't allow the mother to take the baby home if we don't assess the respiration. That's the last thing you do before you can score ABGA 10/10. Okay. Before you can score the ABGA 10/10. So respiration. Is the baby breathing? Yes or no? If they are breathing, okay. When we take the component respiration, when we say somebody is respirating, it's not about looking at me, breathing in, out. It's not really about that. We have the volume, the rate, and the rhythm. These 3, RRV. You do the same thing for the heart too. To cardiorespiratory, you can't say I have assessed somebody's respiratory rate without doing these 3 things. So write it down from today onwards. Okay, you write it down. We always concentrate on the rate in a space of 60 seconds. How many respiratory rates did you give me? That is what most people look at. But let's look at the volume. How deep the volume. Okay. Somebody has come with what? Pneumonia. They are having severe chest pain. When there is pain, there is what? Loss of activity. Remember, so if my leg is paining me, I won't walk. No matter what you do, I won't walk. Okay. If your head is paining and somebody asks you, shake your head, will you do? You will not do. So if you have chest pain, can this patient breathe? He or she can breathe, but he will not breathe because it's equal to loss of function or loss of activity. Okay. So this is my chest. Mm. I take in breath. You look at me. I take in breath. Breathe in. You see how my chest rose up. If I'm having pain, eh, let's say I was here. This is where this was. Breathe in, then your muscles and your ribs they will expand. Okay, so they expand out, chest out like this. But if I have pain, you realize that the patient cannot go from here to here or here to here. They only went only this and stop, and only this and stop. So, how much volume were you able to accumulate inside you when we ask you to breathe in? And when we ask you to breathe out, how much volume are you able to breathe out? Okay, we call it tidal volume. Mm, tidal volume. Those of you who like ventilators, you see the word venti. Tidal. So the volume, is the patient having pain? Has somebody choked the patient with knife or what? Okay, this baby came out of somebody's pelvis with plenty bones. Okay, how was the baby delivered? Passing through all these bones, maneuvering itself, and now out. Is the patient having any problem with the chest bones, with the muscles? Has the patient aspirated anything that is causing problems? Okay. So the last thing we do before you, the mother, you can take your baby home, okay, is to what? Measure the respiratory rate. So the volume comes in. Now the rate dim. If I give you a space of 60 seconds, Reading talks about what? Consistency. 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 So 60 seconds is equal to 1 minute. In that 1 minute, how many rates did you give me? You gave me, let's say, 18, but this baby will give you, let's say, 28. Yes, and above. 28 count. So 28 count. Okay. So it means that the baby got you 1 second, one count, breathing and breathe out, one count, waited for 2 seconds and gave you another, waited for another 2 seconds and gave you another, waited for another 2 seconds. So across these 60 seconds, anytime the baby breathes in and out, that is one cycle, he will wait for 2 seconds before he starts another cycle. Okay, you will see a patient that within this is 60 seconds, they breathe one, wait for 2 seconds, breathe another one again, wait for 5 seconds, breathe another one again. So their waiting period is inconsistent. Then they will come and wait for another 3 seconds, breathe again. So that inconsistency talks about what? Rhythm. When we see this, we will say you have what? Arrhythmia, arrhythmia, or dysrhythmia. Okay. You are not maintaining what? Rhythm, proper, consistent rhythm. Mm. So you see, the same thing we do for what? Heart. The same thing we do. So what is the trick here? Baby is born. We start with the cardio and we end with the respiratory. So combine together, cardio respiratory. If I don't know how my heart rate is doing at the beginning, sorry, I don't know what my heart rate is doing. I don't know what my respiratory rate is doing. The muscle function, I cannot let you take the baby home. Mm. Can't let you take this baby home. So I've got all this scoring, put it under 10. It is on you. Now let's go. Examination will come. For those of you who are going to write exams, or as we health workers, you will see the nurse's note. Somebody scored an ABGA of what? 7, 8, 9, or 10 within so and so minutes. First minute, 5 minutes, 10 minutes. When the score is between 7 and 10, it's normal. So you continue with your routine care. Go and bath the baby. Go and do this. Go and wrap the baby. Routine care. Clean the baby bum bum. Put pad. Put whatever. Put oil, baby oil. All this. They are all routine cares. Life goes on. When you fall between 4 to 6, it is moderate distress. Baby came out and is having fetal distress or moderate baby distress. Okay. So your oxygen, your stimulation, yes. So over here, you see the mothers and the midwife beating the child. They will beat you out and you cry. They stimulate you proper, so that you cry, so that the Abgal score will go up. Mhm. And as part of crying, you breathe in and you increase the rate, increase the hair. So all the cyanosis and everything will vanish. Yes. Then over here, severe distress. 0 to 3. Oga. Hmm. Resuscitation. Resuscitation. So you know the trick. So here, if you are not careful, we can even intubate the patient or we do CPR. Okay. To resuscitate the patient. Cool. This baby, when labor was about to start, it started with what? Phase 1 of labor. And phase 1 of labor is what? Is divided into 3. One, the latency, the active, and what? The transition. Now, this baby is out. Okay, we are doing ABGA scoring. So ABGA scoring, to when we score, we group them into 2. So the distress, the normal, the moderate, and the severe distress. Okay, now let's go and look at something. All these ones, when you combine all these marks, when you combine, you get 10. All these ones, when you combine, you get 10. Okay. In the latency phase, the service will dilate from what? 0 to 3. Severe distress, 0 to 3. Are we on course? Are we on course? Okay. After 0, you go what? Add 3 to this. Or add 4. Let me say 4. Add 4 to this, you get 7. In between this 3 and 7, you get 4 to what? 6 here. Okay. Here to add your 4. What is up? Sorry. Can you hear me now? Let me see those.
Yes, sir, we can hear you now.
You can hear me now.
Yes, sir.
Okay.
The videos were on, maybe it's a kind of
Yeah. Let me see if those online. Let me stop the share and share it again. Okay. Right. So let's continue. So I was saying that before this baby was born, they go through labor. And the first phase or stage of labor has three divisions. We have the latency, the active, and the transition. When this baby is born, they go through the assessment of ABGA. And the ABGA 2 is divided into three. So let me start from the severe distress, the moderate distress, and the normal. Okay. Yes. So if you combine all these, you get 10. Combine all these, you get 10. Here to combine everything, you get 10. Maternity and 10. I don't know where they got it from. Okay. This latency phase, the service will dilate from 0 towards 3. The severe distress, the ABGA will be 0 to 3. Vivian, stop writing on my board. In the active phase of labor, which is so after 3, you jump to 4. You are on number 4. You are counting 0 to 10. So 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the first phase has taken the first 3. So let us come here 4 again. Add 3 to them. Here will end at what? 7. And here will end at what? 7. Okay. I'll explain something to you. Let's go to transition. Since we are ending at 10, here is going to be what? 8, 9, and 10. And here, the normal guy is also going to be 8, 9, and 10. Okay. But look at something. Because we are dealing with ABGA, and because our aim is to let the baby be normal, they mostly bring this 7 here and make this 6. So instead of adding 3, it's addition is 3, 3, 3. 3 additions. So when you get here to be 3, ideally you were supposed to add the next 3 to make it 3. So 3 plus 4, 7. Okay. But rather you added the 3 to this 3 to make it 6. Instead of adding the 3 to this 3. Okay. Where did this 3, 3, 3, 3 come from? Let us go and start from the beginning of pregnancy. Somebody is pregnant. How many months? 9 months pregnancy. How many months? Or how many divisions of 3 can we get into this 9 months? We can get 3, 3, 3. The first 3 months is the first trimester. The second 3 months is the second trimester. And the third 3 months is the third trimester. So it's a game of 3. If you don't know this thing, you always be chewing your books. You learn finish today, tomorrow you've forgotten. So when I'm starting pregnancy, when I'm starting pregnancy. And this same three, if you want to relate it in pregnancy, you relate it because even in the GT Parlin, we divided the year into what? 12 months. Okay. And we said that a pregnant woman will use what? 9 months to get pregnant and 3 months for break or rest. So if your month, if the month you got pregnant or your last menstrual date falls within the first 3 months of the year, January, February, March, it means you deliver within that same year. Okay. But if you are within your last menstrual period is within the last 9 months of the year, you deliver the following year. So it's a game of three. Pregnancy and childcare is a game of threes. So you see that the three will be rhyming every phase we get to. The first 3 months, first trimester, second trimester, third trimester, when the woman has carried the baby and it is now time for labor. The first stage of labor before we take the patient to the delivery room to start delivering. The first stage will also is divided into three: the latency, the active, and the transition. Make here 0 to 3. Go to the next one, 4. Add 3 to 8 to 7. And the next one, 8 to 10. You are done. So game of threes. When this baby is born, let us do the ABGA scoring. So you know that 0 to 3 is your severe distress. If I add 3 to this, I'll get 6. Okay, what if, so meaning after 3, I will get 4 here. So it's going to be 4 to 6. That is the moderate distress. Let me add another hot 3. It's a game of 3, but you have to end at 10. Okay. Let me also from 6, I go to 7. Let me add another 3. 3 plus 7, 10. This is a normal baby. You are done. So 3, 3, 3. You don't have to learn this. If you know this trick, you don't have to learn it again. You are done for the rest of your life as a health worker. You are done. Do we have to memorize ABGA scoring again? So if the baby is having severe distress, immediate resuscitation, you can intubate, do all the CPR, whatever, resuscitation, gather the people, rapid response, they should come and help you. Okay? Call the doctors. Problem has come, emergency has come, complication has occurred. Moderate, you do your blow-bys, oxygen, simulate. So a lot of babies you'll be walking behind the maternity room and somebody will be beating your baby. Ming, 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 ming. Majority of babies born fall under moderate distress. You want baby to cry. When you cry, you're breathing air. So all this cyanosis and everything will vanish away. That's it. Okay. So it's a game of 3. It's a game of 3. Okay. So ABGA score does not predict long-term outcomes. ABGA score is not used to decide resuscitation. Resuscitation happens immediately if needed. ABGA does not replace full newborn assessment. Yes. The most common abnormal findings is the acrocyanosis. The middle is pink, and the extremities are bluish. Heart rate of more than 10 is the most important indicator of newborn stability, heart rate. So I told you that it's cardiorespiratory. It starts with the heart rate, then I end with the respiration. Before you say, Ayaraga's wife, this is your baby. Take the baby and go home. Champion. Are we okay? hold your questions and I will let you know. Right. Let's go to growth and development. Now, baby is growing. Growth and development has so many factors. Okay. So the factors were brought up. We want you to give us a protocol for us to follow. This baby is born. So from 0 to maybe 18 years. Come and tell us something. Then someone said that I will talk about the psycho and social aspect. Okay. So look at this. This is the mind. I told you that we have done APGAR scoring. If there is a problem, we go to the control center of the brain. Okay. So they look at what? This is my mind. This is my brain. How does the brain itself control itself? That is one. How does the brain affect the social ability of this patient or this boy or child? How does the brain or the mind affect the sexual aspect? And how does the brain affect what? Help you to develop these two guys. Cognitive development. Okay, yes. So in develop, let me write here development itself, whichever way you want to explain it. So let's look at what the social. Human being born has a brain, but this brain tells someone that if I see Ayariga around me, Ayariga is a thief. The brain is interpreting something to you about Ayariga. If I see Dave around me, it means that David is a pastor. So let me like him. If I see Mercy, Mercy is so and so. So what is the relationship between your mind, your psycho, and your social relationship, your social abilities? Are you going to like your society or are you going to hate people around you? Okay. We can grow. There are people who have even grown to date. Their mind is always telling them negative things about people in the society. Everybody they see in the society, they suspect the person to be bad. That is psychosocial. All these things comes together to make up what? A human being. Okay? You can develop here, but you'll be retarding here. You can develop here, but you'll be having issues here. Some people are very good. So this is this mind. How does the mind and sexuality relate? Okay. There are some people, their mind is always telling that everything they get inside their mouth. So they are orally fixated. Everything they get inside their some body part. Some people will develop in that latency, phallic, all this stuff. Okay, it is the mind. There are divisions of sexuality. So somebody will be grown, but the mind is still controlling him or her. That whatever you get, wherever your hands touch, it should go through your mouth. Okay, so you are stuck there. As the baby is growing, they should reach a stage that the oral satisfaction should vanish. But this person was overly dependent. It's like drinking cocaine. You have become so overly dependent on that oral things to the extent that now you are addicted. It has become part of you. So when you move to the next phase of life, you still be seeing what signs of this oral stuff here. Somebody is anal. Okay. Yes. Toilet training, neatness, dirty, all this one. Everything that comes out of the anus is dirt. The toilet. Mm. How are you training your child? If you train the child that anything that comes out of the anus should be cleaned immediately. Okay. So your baby poo-pooed, is wearing diaper, he poo-pooed. In the mind of the brain, never think they are not. I mean, the senses will take the information that something is touching my skin, take it to the brain. So the brain, the senses, the sensory nerves will take it to the brain, and the brain will interpret that hey, it needs to be clean. Can the baby clean the poo-poo? No, it is the mother who has to clean. So when the mother quickly cleans after seeing the baby has poo-poo, the mind will be like, okay, and the senses will be like, okay, anytime there is poo-poo, we should clean. But the senses have been sent to the brain. Brain has interpreted it. Baby cannot clean himself. Mother has to clean. If mother does not clean because mother is saying, oh, it is not time to bath, so I will not clean you. I will not change your diaper. Okay. The baby's mind will now adapt to what the society is presenting to it. That it is not always necessary that when I make dirty things, I should clean up. So they will now leave that environment of poo-poo and they go to their household. When there is dirt, baller, rubbish in the house, the mind has been conditioned from childhood that it's not always you see rubbish that you need to clean. You only clean it when it is convenient for you. So a lot of people have grown with what? Inner fixation. It's not like they eat feces. So they don't eat feces, but they are hot. They are stuck. Okay. Next. Do you want to check addiction? Go to this person's house. Okay. Marry this person. You are a neat guy, and he too is a dirty guy. Marry. Try to control this guy. That hey, clean your house, clean your house. He'll be angry with you. That is what the sign of addiction. Okay. Yes. And the cognitive development comes in. Mm. As you are growing, as you are deep. So all these two guys, social, sexual, cognitive, we give you complex activities to do. How is the brain developing itself? The brain, as part of advising these guys, it also advises itself. Self. So the brain can train somebody that mathematics is difficult. Oh, I don't like maths. I will do art. We were all born with what? The same brain. But what is your brain telling you? Is the brain advising itself? Okay, there is NCLES. Let us go and write NCLES. If you want to travel as a nurse, NCLES is one of the examinations you write. Somebody's mind will advise that These exams, it's difficult to if you write. Okay. Yes, this is the destination of development, of progress. You are here. Your mind is telling you that this is a long. See, let's stay in Ghana, stay in Africa. You will make it. Yes. Then you divert your mind. Then you know what? The more you train yourself, mm, society too will bring what? It's like magic. It's not magical. It is physiology, it's biology. So whatever you tell yourself, society too will find a way and bring you an example of whatever you have decided on. Yes. It will bring you an example of what you've decided on. So the society will bring somebody who is good in class, went to write in class and has failed. I told you. See, this thing, see, let's stay in Ghana. Don't try. That is cognitive. So people will be dodging as we are growing. We will be segregating. Me, I want this cheap side. Me, I want this soft life. Me, I don't want to move. Me, somebody will do one job. Things are not going well. Still there, stag. It's not their fault too. They are fixated. Okay. You can kill them at the job. Somebody will marry. The husband is beating or the wife is tormenting. I mean, the mind has trained the person that stay till death. So they will stay. It's this the mind is advising itself, and the mind controls the body, and the body only does what the mind decide. Okay. So a child is 18 years. But this child will be always brilliant in class. It did not start from there. It started from somewhere that they will read. But at the same time, let us bring an abstract work, very difficult and tricky assignment. Let's bring it. The mind will tell another person that, see, this thing, I will not do. Somebody have finished diploma, eh? And is still for 15, 20 years, still working as a diploma nurse. But we pay all of us the same salary. Somebody has used his salary to advance and now holding masters. The same classmates, another person is also holding what diploma. It is what your mind tells. So the mind will tell you, after the mind advises you, the society will also, so we call it a biological algorithm. Okay. Let me open your eyes. Let me give you a typical example. We have 30 minutes, sorry, to leave. Let me give you a typical example. All this AI today you are seeing, it is something that is there, but you don't know. You and I don't know. I'm explaining this biological algorithm to you. That whatever you tell your mind, you allow your mind to decide for you. Eh? The society, the environment you are will also give you an example. If the mind tells you that go and be a thief, the environment will give you an example of a thief who is very successful so that you go and do it. That is what we call cognitive development. If the mind tells you to go to school, the society will give you a typical, you see with your fake naked eyes. Okay, we call it biological algorithm. Algorithm. Is that how we spell algorithm? Yes. Let me relate it to IT. Today, everybody likes social media. All of us, we are joining, even through social media. I'm talking to you from my house. Okay. Time you and your friend, okay, this is a man and this is a woman. Let me bring relationship issues. Mm. I'm talking about artificial intelligence algorithm, artificial AI, AI algorithm. Okay, they are using this one to develop what? Uh, they are to develop IT, whatever is going on around human beings, to develop IT and present to human being so that you like it, you share, okay, and they will get money and you will be poor, okay. So this is a man. Please mute yourself if you are not talking. So this is a man and a woman. Let them fight. Let them fight. This is a man who, when the man picks his phone, he will start all of a sudden, he will start seeing what? Uh, he will start seeing adverts, and people's content that are talking about. See, this is the man who, when you pick your phone, go on social media, you start seeing that people are making content which are only talking rubbish about women. That woman is not important. That don't, as a man, don't rely on women. Don't invest in women. Don't at the very moment. eh, Let the woman also go and pick her phone. She will also start seeing content that are what? That are talking rubbish about men. Men are not reliable. Men are so and so. Some, I mean, why? Because of this fight. When you picked your phone and you chanced on one, you chanced. The IT has been programmed in such a way that any content you see as I'm scrolling my phone, any content you see that you stay there for more than 5 seconds, it means you like it. It is a mind game. Okay. So if I see Ayarega insulting another woman and I watch that video for more than 5 seconds, it tells the phone and the IT, the program, whichever platform I'm using, whether Facebook, YouTube, whatever, it tells the platform that this person watching this content likes it. So in future, present only those things to him or her. That is it. Okay. Ever since you started learning English, have you realized that every time it is only English stuff that comes to you? Women should come and testify that ever since they got pregnant, they are always seeing things that will make their pregnancy successful, advert content, and all these things. We call it what? Artificial intelligence algorithm. Okay. So everything this thing, the dangerous aspect is this one, man and woman fighting. A lot of people have divorced because of this. Because whenever you pick your phone, you are fighting with your man or woman, the social media will be advising you and advising the woman. Okay. If you are not careful and you even go and fall into a live session where only women have met, they are spoiling men. And you, man, you go and fall in a live session and you stay on that life, you are doomed. Okay. Like the way I'm doing video for you, you are watching me. From today onwards, if you are new, anytime you go to Facebook or wherever, you'll be seeing algorithms of people doing healthcare because you have stayed with me for more than 1 minute. That is it. So this child too has what? As the baby is growing, the brain will be presenting algorithms. Mm. The baby poo-poo, you were supposed to clean the poo-poo. You didn't clean it. Okay, so dirtiness. Or mathematics question has come. It is difficult. Even those who know book in class and very good in class are hot, are failing. How can I pass? It won't work. Okay. So you demoralize yourself. It is what? A biological algorithm and artificial intelligence algorithm. So that is it. Yes. So what you watch outside there, they are all there to play games with your mind. So these components, these three components combined together will help you and I. We are human beings. We are all influenced by this. Okay, choose your friends well. Because already your brain is telling you so many things. If you are not careful and you go and fall in friends who support what your brain is telling you, that is bad. That is why we have psychologists, clinical psychologists. We have pastors that will do counseling for you and all those counselors, legal counselors. See, if you're having issues with mental dilemmas, we call it mental dilemma. This word, it runs everywhere. Dilemma. You are at a junction that you don't know what to do. Seek advice. Seek advice from a psychologist. They have been trained, counselors, legal counselors, they have been trained in psychology. So they know what to tell you. Don't go to your friend. Your friend will use emotions. Remember what has happened to her long time ago and use it to develop your child. And this child growing, also be careful who grows the child. We should all pray that God will give us long life to take care of our children in the environment. So that's it. So let's look at infancy. Infancy, birth 0 or birth 28 days and above to 1 year, infant. Okay. What did they say? What did they say? So I told you that the psychosocial Erickson spoke about. He showed us the relationship between your mind and your social relationships. Okay, social relationship. Yes. And Piaget, sorry, Sigmund Freud, he's a psychologist, spoke about what? The psychosexual. And Piaget spoke about what? The cognitive development. It is something that everything you are seeing today, it is not, it was there, it was covered. Now people have removed the covering. So we call it discovered or uncovered. Okay, right. So a child between 28 days or 30 days, whatever, to 1 year, infant. How does this child relate, combine what he thinks about and the society? Okay, Erickson would say they have what? Trust. Mistrust. They are standing between two junctions, dilemma. Should I trust my society or mistrust it? It's a dilemma, cognitive dilemma. Should I trust the society I'm living in or I should mistrust it? Yes. So what they need, the protection, the basic needs. Okay. What I need to grow as a child, the family around me, the comfort I get from my family, what I need. Is it given to me? Am I protected? All these things. Okay. It brings trust to the patient, the child. Then the opposite will bring mistrust. Mm. Let's go to the sexual aspect. The mind is telling this guy that everything you see, even if we give you caterpillar, put it in your mouth. All right. All right. Okay. Yes. So, all right. The psychosexual sex. All right. Okay. Now, the cognitive is sensory motor. So we will see what the reflexes. And I've explained to you before, senses will take, motor will bring. Senses will take afferent, efferent, whatever. Yes. So they play solitary lifestyle. Okay. They don't play with anyone except their family members. They don't like strangers. All these ones. Okay. So these are the. Now let's go to physical growth. It's very tested. A baby with birth doubles 5 to 6 months. Your birth weight, it doubles this. So shine your eyes. At 12 months, it triples. You should know. Okay. Doubles, triples. Okay. You don't have to chew it. Just know. How about their length, their height, or length? So every month, it is expected that at least 1 inch for the first 6 months, 1 inch will be added. Look at their head circumference. It increases rapidly as every month goes. In the head, we have fontanelles. Okay. So the posterior and the anterior fontanelles. When the sutures of it, they leave a hole. Okay. So 2 to 3 months, posterior should close, anterior 12 to 18 months. So that is what you should know. Motor development. So in the infancy, how does this person develop the motor skills? Okay. So in motor skills, it's divided into two, the gross and the fine motor skills. So baby is able to lift the head, roll it, able to sit. They are crawling, they are standing, and they are walking. A lot of people forget these three, these two. Okay. And yes, they don't keep attention on these two. They become attentive to this last four. It's normal. I mean, but baby will go through these stages. They are gross. You need a lot of muscles to come together to do this. Okay. Fine, beautiful ones, fine motor skills. The palmar grasping, they are able to grasp. They are able to transfer objects from the hand to here, from their hand to another person. Then the pincer grasping. Okay, it makes them find neatness. They are able to hold a pencil later in life and write with pencil, with pen. Then as the strength comes, they are now drawing. Then they will add color. We have drawn Ghana map. drawn this one map. Okay. People forget about these fine skills because as they are growing, their mind will tell them that this one cry is not important. Okay. Let's not develop it again. Let's focus on something else. They forget, but people who are able to grow with this, they will go to school and they are now architects. Yes. They are now civil engineers. They sit down and draw. They are now artists. They do programs. They do, drawings, better ones, fine scales, nicely. They combine their joints, their muscles, their bones together and their mind and draw a nice. Some people do beautiful statues, fine motor skills. Okay. But a lot of about 70% of the world's population will drop these skills. It is a beautiful skill God gave to every human being. But 70% of the world will drop it and go and do something else. Okay. Yes. So let's look at language. Still infancy, under 1 year, the baby will cry and they coo and they babble by 6 months. So by 12 months, at least, if they don't have, there are 1 to 3 words they should have. Can we join 1 to 3 words to form a sentence? Kofi is coming. At least they have short dependent sentences. Okay. Okay. Dependent sentences because these sentences they form if they don't end it with an independent clause. You can't understand, but at least they have ways to form these sentences. Lamisi is, and Augustina is coming. Coming from where? Is coming home. Another sentence. Okay, so they are more comfortable with dependent. They form these words that they can make that meaningful sentence, a full sentence, which has both the dependent and the independent clause added to it. So Lamisi is coming from the farm. Okay. Whose sentences joined together to make a complex sentence. So this simple dependent sentences. Okay. Cognitive development, PAJ will come in. They learn through senses and motor combined. Object permanence develops by what? 8 to 9 months. So this baby is holding an object. The mind knows that this is a toy. If you collect this toy and hide it, they don't forget that they were holding a toy. A baby 1 month old who is holding this toy, when you collect the toy and hide it, immediately that permanence vanishes. But a baby 8 to 9 months holding this toy, if you take it and hide it, they will be turning their head looking for it. They still remember. Everything is about the mind. Okay. So we have the cause and the effect learning coming in. So back to the the trust development when needs are met consistently, feeding, comfort, bonding from family members. Yes. Okay. When a baby cries and you ignore it, it breaks their hearts. but they can't talk. They can't talk. If they are in their mother's womb, they will not cry, but they will give you a heart rate variabilities. When they come out of their mother's womb, they don't have words, so they cry. So that you have to understand the what is going on behind that cry. Okay. Now they have words, so they can express themselves. So the way when they have words, they can express themselves. When they are crying, don't ignore it because you cause mistrust, you break their hearts. So 10 minutes. There we go. So let's look at their play. So they like to play with rattles, soft blocks, musical toys, mirrors, mobiles. These are good ones for them. Okay. Give it to them to play with it. So to end everything, don't forget this before you enter your exams room. The Monroe reflex, the routine, the Palmer, and the Babinski. Okay. So 3 to 4 months, 4 to 6, 3 to 4 months, 12 months, they should know this. Okay. So these two, the Palmer routine, the Palmer routine, very important. Okay. Safety priorities. Yes. High yield. English will come in. English is about safety. Okay. So when they want to sleep, when you put their back to sleep, you are doing sit prevention. Okay. Sit prevention. Very important. This baby, go and put the face down, lying prostrate. You come in the morning and meet them dead in bed. So always their back and the face up. Like this. To sleep. Please note that. Okay. No honey for baby and milk. You cause infant botulism. Yes, Victor.
Good day, sir. Please, the seed as in sudden infant death syndrome. That's what I wanted, the abbreviation.
Oh, yeah. Sorry.
Thank you very much, sir. Thank you.
There are so many things.
Thank you.
They are not supposed to put toys and all these things when they are sleeping. Safety is very important because it can choke them. It can, suffocate them to die. They are face down. They are all bad practices. So the back to sleep, supine. The ani, their intestines are not strong. There are some bacteria in these anis. Their intestines cannot crush those bacteria. Their intestines cannot eliminate those bacteria. Milk will cause problems from them, especially milk from those animals. People will take milk straight from animal, then they'll be drinking. All this one, there are some little microorganisms. This baby does not have strength to what? To overcome all these bacteria. It will cause indigestion problems for them. Abdominal discomfort. We call it what? Botulism. Okay, botulism, abdominal cramping, they will be crying. Nowadays, people will say that, go and buy them all this fluid liquids, and I'm forgetting the name. Yes. Now, people have capitalized on botulism and all this indigestion.
Water.
Gripe water. People have capitalized on this medical condition to develop medications that they will get money from human beings. Because what is money? Money is providing a need. That's it. If you take a problem in a society, provide a solution, people come and buy. That is money. So choking and aspiration prevention is very important. Be careful, they are orally fixated. So what goes into their mouth? Choking. Then when you put them in a car, are they supposed to show in the, this is the car? Okay. This is the driver. That's the driver's seat. And here, the driver's seat is here, and they to their seat is here. Everybody is facing here. Okay. They should sit behind the driver. Why? If this car is going to get accident and the driver is very conscious, is Victor is driving a car and the car is going to crash, they will definitely turn this side for the crash so that they will be safe. If they should be safe, then this baby should sit directly behind the driver so that if the driver saves himself, the baby will be safe. That is one. Two, if everybody's face is facing here, this child's back should rather face here and the face should face here. So it should be like this. Why? Because their head and their neck are not strong. The vertebral column holding their neck and their shoulders is not strong. So the least thing it can break. When it breaks, the bone can break and the nerves too can break. And that one will cause, if you are not careful, it can cause death. From your hospital, the town you are living, the hospital there, is it having a neurosurgeon? No. So when you break your cervical nerves and the baby cannot breathe, everything has paralyzed from your neck down below. The respiratory muscles have paralyzed. When are you going to transport? Look at the town you are to the nearest, highest facility in your country. Can this baby survive this journey? They will die. So what can we do? Prevention is better than cure. Let's put the baby's head and the baby's face to face here. And the back should face the driver. So that if this is your neck, if you are facing here and the car crashes, bam, your head will be like this. You get forward. Newton's third law of motion. A body will continue to be in motion unless acted on by a force. Okay. So if I don't want instead of the head to jet forward like this, when I crash, the head rather will go back like this. When I crash the front of this car. Okay. And the baby should be in a car seat with seat belts, everything secured. So rear facing is very important. Then water heater burns is another problem. The umbilical fluid is what tepid. It's tepid water. It's a mixture of cold and hot serum. Tepid is very warm. So this baby coming out is comfortable with this warm like water. Don't go and burn them. Don't give them water with temperature more than 45 degrees Celsius or 120 Fahrenheit. You burn their skin. Okay, very important. So guys, today is the end of infancy. Tomorrow we will continue our journey with toddlers. So toddlers 1 to 3 years, what goes on with them? When we are done with toddlers, we go to the next. Okay, so everything about toddlers, you learn it. I'll take it bit by bit. Then after toddlers, we go to the preschoolers. Preschoolers, very important. Then we learn everything about preschoolers. Okay. Then, just like the way we've done the infancy, we do the school age. The child is 6 years old. It's time to go to school. Okay. Nowadays, people have brought a lot of schools. Even the day you give birth, following day, if you want your child to go to school, we have a school ready for him. No. School age, 6 to 12. We are going to learn them. Okay. Then from there, 6 to 12, we enter into teenage adolescent. Okay. We do adolescent. I'm not going to do this. Adult is not a child. We are doing pediatrics. When we get to adults, we will come back to this. Okay. So from here, from this side and above, I'll give you the slide. You can learn it. Fine. 18 to 40 in US. If you want to join military, 18 years, you are in 18, you are adults. Okay. And do whatever you like. But like I said, we are doing pediatrics, not adults. Okay. So we will end here. Then we go to pediatric to learn the medical conditions and their pharmacology and their management. Okay. Thank you so much, guys. Any question?
Thank you, bro. Thank you, sir.
Any question? Is anybody having any question?
We'll have the note at the end of the day, sir.
Yes, I'll post it to the page. Let me do it now.
Yes.
Pediatric nursing. So it's only the note your question.
Sir, please, so I have I need a question. It's a clarity. The car seat, the fixing the car seat, please, the age. I want to clear of the age. Yes.
Yes, so mostly when they are, I would say from, let's say 6 years school age, you put them on a booster. But below this car seat. So have you seen booster before?
No, sir, I'm not clear of that.
Oh, let me show you. Car booster. Kids. Booster. Drivers put booster on their seat like foam. Okay. Yeah. This is booster. You've seen this before.
Yes, sir, I've seen before.
So you can secure it and the baby will be strong. It's a school age guy, 6 years and above. Booster. Okay, I will do that. That is what I do for my kids. Okay. When you do this, police will never arrest you. So you're sitting on the car with on top of a booster, then the seat belt on. Okay. So you buckle. Let me take this. Yes, climb. When I finish, then so you buckle across, then over here to diagonal. Perfect. Then the normal car seat comes in. If you want them to sit in a car seat to chill. Yes, climb.
Boss,
Hand is up.
please, you said they should sit with the car seats in the car rear facing. You said they should sit behind the driver with the baby facing. I didn't get that part well. Sorry.
So, baby, if you see pictures, you'll never forget. Sitting in car seat with rear facing. Why did not giving me? I need.
Hello, sir. Hello, sir.
Yes, Michael.
Millionaire Sam Bregman. Trump
Come
donors
here,
have
2
given
seconds.
him
Let me
over
show.
a quarter
Let me
of
show
$1
you
million
this.
because they
So that
know
you
who to
understand.
fight for. Bregman.
When you have a baby, a rear-facing car seat becomes one of the most important items in your life. A properly installed rear-facing car seat dramatically
You see
reduces the
where?
risk of injury in a crash.
You see
Infants and
where
toddlers'
she's
heads
going to put the baby?
are the heaviest parts
Just
of their
behind
bodies.
where the
They
driver
can't
is.
withstand a crash facing forward.
So easy.
Okay.
A rear-facing seat will support your child's head, neck, and spine during a head-on collision. The seat helps spread the force of the crash across the back.
Okay, I get it.
This video was created by safety experts at Children's Hospital of Philadelphia. We want to make sure you install the seat correctly and that you buckle your child in correctly every single time. Let's get started.
Always sitting behind the driver, and
Okay.
the back of the baby and the back of the driver should
Yeah.
be
Okay. The
together.
back of the
To
baby is
reduce.
facing the back of the driver, right?
Yes,
Okay, I get it.
you understand?
Yeah, I get it.
Yeah. I think I saw one. You see this one, this picture. If the face of the baby is facing the back of the driver and there's a crash, you can get spinal injury.
Oh, okay.
Okay.
All right. Thank you.
What are you doing?
Running. What do you mean? Come on.
Can I have your tablet? No, it's on phone.
Come in 2
Can
seconds.
I have it?
Yeah, so that is it. Michael, you were asking a question. Any question? Okay, so I have pasted the slide on the chat box. Make sure you get it before you leave. I got to post it on the page. So make sure you get it. If you don't have it, and start learning, please. Start learning.
So my
Stop
own
the
please,
share.
you were not able to clarify for me on the age, the car seat rear facing.
That's why I was saying that I have not seen a clear definition of that. But mostly, when they grow, we remove them from that small car seat and we put them. So, like, say 5, 6 years, you should put them on booster. Then maybe 0 to 6 years, put them in that big car seat. You understand?
Okay, sir.
Yeah. So we meet again tomorrow for our class. Thank you so much for joining, and remember to learn. Remember to learn your slide. If you have any question, write it down. Those of you watching from live, if you have any question, write in the chat box. We will answer you. Okay, there will be an answer for you. And also share. And if you are not part of the link, share the videos. The videos will be on YouTube and Facebook. Go join, share, and let others also benefit. Okay. Thank you so much. We meet again same time tomorrow to continue with pediatrics. Be part of this journey and don't be left out. Thank you so much.